Happy Sunday and welcome to the 16th episode of Sense with Science, a community education outreach by Pusat Perubatan Naluri, streamed live by Astro Awani. Today we'll be speaking about COVID-19 and how it affects people with diabetes. With us on the show are, of course, series progenitor, Tan Sri Dr. Jamila Mahmud, advisor to the Prime Minister of Malaysian Public Health, and co-chair, infectious diseases specialist and World Health Organization Science Council member, Professor Dr. Adiba Kamaruzzaman.
Assalamualaikum. Good evening, everyone, or good afternoon. Welcome back. This is episode 16. Gosh, I can't believe it's already been 16 episodes. Selamat tengah hari semua. It's good to see everybody, and we are back here with a very important session on Sense with Science. Really pleased that every week we seem to be getting more and more people joining us. So terima kasih kepada mereka yang sudi mengikuti rancangan Sense with Science bersama Karen, Adiba dan tetamu-tetamu khas kita. Dan kita tahu that banyak dikatakan mengenai penyakit kencing manis atau diabetes mellitus dan COVID. Kita selalu dengar laporan-laporan yang menyatakan komorbiditi seperti darah tinggi, kencing manis dan bagaimana keadaan seorang pesakit itu menjadi sangat serius ataupun boleh membawa maut jika berkaitan dengan komorbiditi seperti kencing manis juga. Jadi today kita nak fokus kepada penyakit-penyakit komorbiditi ini, terutamanya kencing manis yang memang juga dikaitkan dengan obesiti, dan kita ada tetamu yang sangat khas pada hari ini. Over to you, Adiba.
Assalamualaikum dan selamat petang. Terima kasih kerana bersama kita sekali lagi di program Sense with Science. Seperti kata Tan Sri tadi, COVID dan penyakit kencing manis adalah salah satu daripada risiko yang membuatkan pesakit yang menghidapi COVID-19 mendapat jenis COVID yang berbahaya. Ya. Seperti kita tahu, 80% dapat sembuh daripada COVID-19, tapi antara pesakit-pesakit yang Dr. Lim bersama saya merawat di Pusat Perubatan Universiti Malaya yang masuk ke ICU yang memerlukan bantuan pernafasan, ramai di antara mereka mengidap kencing manis. Jadi saya, Karen bersama Tan Sri Jamilah merasa sangat penting kita membincangkan tajuk ini oleh kerana bukan saja dari aspek COVID ya, tetapi oleh kerana seperti yang kita akan dengar daripada Dr. Lim, di Malaysia ini penyakit kencing manis boleh juga dikatakan sudah mencapai satu wabak juga ya, sebab komplikasi dari penyakit kencing manis bukan saja hanya kepada COVID-19. So, tetamu khas kita pada hari ini adalah Dr. Lim, rakan saya di Pusat Perubatan Universiti Malaya. Kalau I know there are many endocrinologists dan pakar kencing manis di Malaysia, tetapi Karen, Tan Sri Jamilah dan saya seboleh-bolehnya nak cari pakar wanita ya. Lagipun Dr. Lim baru saja pulang dari Hong Kong, di mana beliau mendapat PhD dari Chinese University of Hong Kong di bidang diabetes dan amat tepat sebagai tetamu khas kita hari ini. So, Karen, over to you.
So, as Professor Adiba has said in Malay, our guest today is Associate Professor Dr. Lee Ling Lim, a consultant endocrinologist who's going to help our viewers understand the challenges a diabetic would be faced with if they contract COVID-19. Before we start, Dr. Lim, could you introduce yourself and tell us a little bit about what you do? Please don't oversimplify your work, because your body of work is excellent and your fields of research are really phenomenal. So just the floor is yours for now.
Thank you very much, and hi everyone. Again, thanks for the generous introduction from Prof. Adiba, Tan Sri Jamila, as well as Karen. I'm Liling from UM. I'm a medical specialist I'm interested in diagnosing and treating health conditions related to body hormones, and this certainly includes diabetes. I've been involved with the Lancet Commission on Diabetes, as well as the American and European Society of Diabetes, trying to look into any ways, whether is it for us to try to prevent and treat diabetes. Indeed, it's my honor to participate in this Facebook Live on diabetes and COVID, together with Tan Dr. Jamila and Professor Dato Adiba, and moderated by Karen. Over to you, Karen.
So just so we start on a level playing field, for those who may not know, diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose or blood sugar. And this can lead to serious complications to the heart, the blood vessels, eyes, kidneys, and nerves if it's not properly controlled. Insulin produced by the beta cells in the pancreas is a naturally occurring hormone in our bodies. And this hormone helps regulate and maintain blood sugar levels. However, with diabetes, the body either does not make enough insulin, as seen in type 1 diabetes, where you have insulin deficiency, or you cannot effectively use the insulin that the body does make, as seen in type 2 diabetes, which is insulin resistant. So Dr. Lim, one question that many diabetics have asked during this time of pandemic is, are people with diabetes more likely to get COVID-19?
Thank you, Karen. Thanks for the very succinct summary of what does diabetes being defined previously, whether it's a type 1, as what you have clearly shown, there's lack of insulin, or even type 2. But what we've known so far since the COVID pandemic, we know that patients with diabetes, when actually compared to those without diabetes, they are not at higher risk of getting the virus infection. But if they do get COVID infection, people with diabetes are more likely to have serious complications, such as pneumonia or lung infection. They may require hospital admission or even ICU care. Another important piece of information is people with diabetes are more likely to die from COVID infection. One thing that we need to get across to the community is diabetes is not a single condition. People with diabetes tend to have multiple health conditions, like what Tan Sri Jamila has mentioned just now. They tend to have obesity together, they have heart problem, the heart can't pump well, heart failure, even kidney disease. So the more health condition that a person with diabetes has, this actually adds to their risk of getting serious complications from COVID infection. Over to you, Karen.
This is really especially worrying, right? Seeing that diabetes has been one of the major non-communicable illnesses in Malaysia. It affects up to 3.6 million of the Malaysian population. 7 million Malaysian adults aged 18 years and above are estimated to develop diabetes by 2025. This is a major public health concern. It's huge. So my next question, Dr. Lim, is why are people with diabetes more likely to have serious complications from COVID-19?
In general, one concept that we need to understand is people with diabetes are more likely to have serious symptoms and complications whenever they are infected with any infection, whether it's a virus, whether it's a bacteria or fungus. And this certainly applies to COVID-19 infection. But if the diabetes is well controlled, your sugar level, whenever that you go to the hospital and clinics, the doctors will keep praising you, oh, okay, your diabetes is so good. You are the good role model to other patients. Your risk of getting very sick from COVID is likely to be lower. And what I've said just now, that when a person with diabetes, they have multiple health conditions tend to occur together, then that will actually put them at even higher risk of getting serious complications from COVID infection. Why? Because when you have more than one condition, it actually makes it harder for your body to churn the sufficient immune response to fight the infection. This is even worse when the diabetes is poorly controlled, you have very high blood sugar levels. Over to you, Karen.
You know, when the Ministry of Health released its data on COVID on the 18th of June, when they listed the numbers of the dead. And of the dead, with comorbidities, there were 61 deaths with people with comorbidities, and there were 13, only 13 deaths of people who did not have any comorbidities whatsoever. This is a very startling revelation. If anybody is, and I'm sure very many of us are on the platform where the Ministry of Health actually sends out its data on Telegram, you'll see those numbers, and those numbers are nothing to scoff at. Professor Adiba, you actually see patients on a day-to-day basis at PPUM, and you see these patients in the COVID wards. Would you be able to give us an idea of how many of these COVID sufferers are actually also people living with diabetes? Your mic, Adiba.
We currently we have about 200 beds for general COVID patients from, those with categories, what we classify as having categories 3 and above, meaning people with symptoms or those at risk of progressing to more severe disease, and roughly about 40 ICU beds. And invariably, those who are in ICU, I would say more than 60 or 70% would have diabetes as a comorbid condition. So this was what prompted me to suggest this this session, actually, because it's really concerning, and especially because, as you heard, the current numbers of Malaysians with diabetes, type 2 diabetes in particular, and others, and mind you, it's not just COVID-19. We know that patients with diabetes, as Li-Ling said, also tend to have more severe other infections, and the one that stands out would be dengue as well, and because the mechanism for developing severe disease is I won't say the same, but a similar sort of immune response, inflammation that goes on in patients with diabetes.
If I may add something, Karen, many people around the world now, particularly those of us who work on health issues, have really referred to our current COVID-19 pandemic as a syndemic, which means that it's not just COVID-19, but it's also other compounding factors like non-communicable diseases, like diabetes, obesity, hypertension, that have really, really just augmented, accelerated, complicated, the progress of and the outcome of COVID-19. So for Malaysians who are listening, bagi rakyat Malaysia yang mendengar, non-communicable disease, maknanya penyakit yang tak berjangkit, is probably going to be one of our biggest challenges, health challenges pada masa depan. Sebab terlalu ramai yang tidak menjaga kesihatan sendiri, dan sebab kita tahu penyakit seperti kencing manis, darah tinggi, semua adalah juga berkaitan dengan lifestyle. It's about what we eat. It's about how little we exercise, me included. So I think that, this is a real wake-up call. If anything, I hope when we come out of this pandemic, we will really be able to tackle some of these really big issues that we have. Prof. Adiba and I, I'm very happy that Prof. Adiba is supporting some of the work I'm doing on the health reform for Malaysia. And we realize that the health costs for Malaysia is going to be just continually escalating as long as we don't focus on these things and also focus on preventing disease. So I just thought I'd put a little bit more context into that.
Absolutely. And I think, Dr. Jim, also as a gynecologist yourself, you've spoken so many times about the risk that women put themselves and their unborn babies into when they come into a pregnancy with rampant, uncontrolled diabetes, and now more than ever in this time of COVID, where women with diabetes are giving birth, are getting pregnant, there is a huge concern about cases like this. Don't you agree?
Absolutely. I mean, as an obstetrician gynecologist, we know that women who are pregnant and who develop, either who are diabetic to start with, they need to be well controlled before they're pregnant. But there's something also called gestational diabetes, which is very much related to, someone's predisposition to diabetes manifesting in pregnancy. So the outcomes for them could be bad if it's not well controlled. Also, the babies tend to be very big. You have complicated births. So there's a lot of issues there. So I think kita tak boleh abaikan dan tak boleh ambil dengan ringan kencing manis. We have to take diabetes and other metabolic diseases very seriously. So this is why we are very lucky to have Dr. Lim with us today.
And then as a follow-up to Tan Sri's comments about the, as well as Karen's comment that you actually brought up the problem, saying that we do see a lot more women who either have diabetes before pregnancy or they have diabetes during pregnancy. If you look into those with gestational diabetes, we do have evidence showing saying that these women, they will need to have lifelong follow-up with sugar check regularly every 1 to 3 years, because the history of having gestational diabetes, kencing manis semasa mengandung, so this would actually put them at higher risk of getting the true diabetes in the near future. Similarly to their offspring, whether anak-anak, so when their offspring are also at higher risk of getting childhood obesity, and again, this is a vicious cycle. So they tend to have a younger age of diabetes and they become pregnant, and every generation will be repetitive.
I think, also, Dr. Lim, there has been a marked increase in the number of patients who are manifesting with diabetes at a very, very early age. It used to be a problem which only hit in the Middle Ages. Now you have much younger people, sometimes teens, people in their 20s who come to you and they're shocked to discover they're diabetic. Would you say that that is truly a trend and an alarming one?
Yes, it is really alarming, Karen. We, as in Malaysia, even if you look at our national diabetes results, adults more than 18 years, every 1 in 5 actually have diabetes. And then we see a lot more people who present with diabetes before the age of 40 or even 30. Why? Because our obesity rate is half. 50%, everyone, you just throw a stone, every 1 in 2 will actually have obesity. Just putting that aside. Yes, Karen.
I agree. I'm in that much horrible boat.
Yeah, just putting that aside, statistics remain to be statistic. One thing is we tend to have sedentary lifestyle. We don't exercise that much, whether it's because we were too used to having cars, we are not too used to public transport because of the weather, or our diet. We actually consume a lot more carbohydrate dense and fatty diet versus those healthy diet, whether it's because of accessibility and affordability. And I believe policymakers as well as the community will need to ponder on these potential mechanisms.
Because Malaysians live to eat, Dr. Lim, not eat to live.
That's so true. That is so true. But responding to a comment by one of our viewers on Facebook, nutrition can save our nation. We are what our food is. And it's true. We are exactly what we eat. And it is because of the things that we've been eating, which has landed us in the situation, And so the onus is not only on the government, but it's on to each individual to change your lifestyle habits. It's not about medication and what medication can do to you and for you, but about a very targeted plan where you can maintain your health for the best of your family, yourself, and your community and your nation. So coming back to COVID and diabetes, Dr. Lim, are there any specific health measures a person with diabetes needs to take in order to protect themselves from COVID?
Karen, in my opinion, this can be divided into 2 parts. The first part would be a specific diabetes management per se, and the second part will actually be COVID prevention. So if we zoom into the diabetes management per se, Again, people with diabetes are recommended to follow medical advice. You should take your medication regularly. Self-care at home is highly recommended. You should check your sugar at home. You even check your blood pressure. Healthy lifestyle, try to practice a balanced diet. More veggies, more fibers, and less on carbs or fat. Try to do regular exercise. You know, everybody is actually having full during this full MCO. You can't work most of the time. You work from home, so try to just spare at least half an hour a day to exercise to maintain a higher metabolic rate. All these measures will help to ensure good diabetes control. And I wish to highlight again, when you have good diabetes control, this can reduce the risk of getting serious complications from COVID infection. And the second part will be the general COVID prevention measures, has been highlighted by Tan Sri and Prof. Adiba together with the KKM guidelines to maintain the SOP in place, social distancing, mask wearing, wash your hands thoroughly, and avoid touching your eyes, nose, or mouth. All this will help to further reduce the risk of contracting the virus. Over to you, Karen.
Absolutely. I think so. As all our professionals have always said, there is no one specific set of guidelines to keep one segment of the public safer. You know, the protocols remain the same across the board. You know, social distancing, mask wearing, hand washing, making sure not to touch your hands to your eyes, to your ears, to your mouth. All this is a par for course, and we've been doing this for the past 16 months already, you know. But the adjacent to that is the self-care. The adjacent to that is to not allow your guard to slip during this time of COVID. So many of my diabetic friends have said to me, "Oh yeah, I've got nothing to do lah. I'm just ordering, you know, Grab food, and I've ordered a pint of ice cream today." And I'm like, "But you know, you've always been good about ice cream, and ice cream has always been one scoop at Baskin-Robbins once in 3 months. And how come this is like the second time this week you're ordering a pint of ice cream? And I know you live alone, so you're eating this pint by yourself." You know, it's these things that we have to be very, very cognizant of. And if it's not for us, as if we're not diabetic, then it is for the friends and the people and our parents that we live in. It's very, very important that we take a stand to help others also manage and see that they might be walking into very dangerous waters during this time of COVID. Don't you think, Dr. Lin?
Yes, I mean, totally agree. Another thing, if you were to go for grocery shopping, one thing for you to try to calculate what kind of food that you're actually buying. You can just turn it around, look at the nutrition labeling. So, I mean, if you have difficulty, I mean, you can even calculate whatever category per servings or per the grams of that, for example, a sardine. You can know, I mean, you'll be surprised how much calories that you will consume a day just by having these extra scoops or extra tins of unhealthy diet.
Absolutely.
If I can chime in there, I think, you know, Ministry of Health Suku Suku Separuh campaign is really, really good, because it's hard for us Malaysians. I think we love our rice, we love our goreng, and you know, in the past we used to eat a lot of ulam, but now, you know, we've progressed. We've become wealthier. We move from eating lots of sayur to eating lots of fried chicken, and you know, all the unhealthy food. But on top of that, it's the amount of rice that we consume, and not just rice, but noodles as well. So I think Ministry of Health's long-running Suku Suku Separuh campaign is really good, because people can actually, you know, changing behavior is so important. I should know, I do HIV/AIDS, you know, and Malaysians, you know, and their food, you can't separate. And so by giving them kind of concrete advice as to how you can reduce your portions rather than just say no, I think it's a good step. You know, I'm always, when I go and do ward rounds and see patients who either having an impending amputation or have just had an amputation from horrible diabetic foot ulcers and disease, you know, and you see them tucking into a plate full of nasi lemak, and you just go, ah. But then they'll say, tak apalah doktor, nampak macam mana, saya suka makan nasi lemak, you know. So I'm sure you see that all the time, Liling, right?
Yes, Prof. Deepa. I mean, awareness and health behavior takes a long time to change. But hopefully that with this program, and as well as the effort from multi-stakeholders, we were able to achieve that.
Yeah, truly, I think our progression is regression in so many ways. You know, when we used to live off the land, we never used to be as unhealthy as we are today. You know, it's very, very difficult, but it is what it is. But it doesn't mean that we have to live with it. You know, we have to be bold enough to make those changes. It's difficult, especially when quick and convenient is so sexy and it's so accessible, but it's necessary for us and for our generations and for our nations for us to relook at where we're going on this. So Dr. Lim, taking a slightly deeper dive, let's talk about diabetic ketoacidosis, DKA. So DKA happens when high levels of acids called ketones build up in our blood. It's said to be very serious, but can you expound on this and tell us a little bit of how it can affect a patient with diabetes who may have COVID?
Thank you, Karen. So as a general concept, when a person with diabetes is sick with any infection, there's always an increased risk of diabetic ketoacidosis, or in short, we call this a DKA. And this is more commonly experienced by people with type 1 diabetes. But on the other spectrum would be, we call it as HSS. It's a hyperglycemic hyperosmolar syndrome, and it is more commonly seen in people with type 2 diabetes. So both conditions, DKA and HSS, what do they usually present? They tend to have high blood sugar level. They tend to be very dehydrated. DKA patients, they even have high acids in the blood, and they always complain having difficulty in breathing or very fast breathing. Both of these conditions can lead to death. So if you do get sick, what should you do? First thing, stay hydrated. You try to drink lots of unsweetened drinks. You can have small sips every 15 minutes. If you're when you're doing self-care at home, when you check your sugar regularly, and you found out that your sugar levels has been high, more than 13 millimole per liter from your sugar meter, more than 2 times in a row, then you have to check for blood ketones. And if your blood ketones is positive, there's a high chance that you have DKA. You have to call the nearest hospital or clinic immediately. Don't worry whether your calls will be entertained during COVID. Emergency situation will be tackled as per usual medical service. We won't neglect your health, your conditions. Yeah. And the other thing is, if you are on insulin injection or you're doing the sugar check at home, remember you still need to wash your hands thoroughly. Try to clean the finger stick area, clean your insulin injection area with rubbing alcohol, meaning have to maintain personal hygiene as much as possible. Over to you, Karen.
Karen,
yes.
If I may interject again, I think one thing that maybe people don't realize is it being diabetic and your diet per se. We've been talking a little bit about how we must go back to a healthier diet, and the suku separuh is a very good move. We many don't realize it also predisposes us to other things like sugar's relationship with cancer and other diseases as well. So I think that it really someone said earlier, you are what you eat, right? And I think it's very true. I'm guilty as charged, but but we, as long as we realize that and we try our best. I've always been overweight, right, all my life, I think. But I think one of the things I've been quite cognizant of is really ensuring that there are days where I go meat free, I cut down my carbs, I try, you know, at a very personal level, grow my own food and all that. So I think, you know, everyone has to decide how he or she tackles it, because you can't, this behavior change starts with you, right? The desire to change the way you eat or the way you behave. I also think that one of the problems with COVID-19 and being at home, people get bored, and when they're bored, they eat. And I worry also about young people, young children, you know, those who are not going to school and they're not able to, you know, burn off their energy, that they will tend to snack and eat and all that. So I think these are real issues that are difficult to manage during a pandemic. I mean, if you have diabetes and COVID, but imagine watching your diet as well is going to be difficult. And I think that we have to be cognizant as well that if someone is facing economical challenges, the cheapest food is actually the unhealthiest food. And you know, vegetables, for example, have gone up in price. A lot of fresh fish, you know, this have gone up in price. So I think, you know, we have to find a way. I mean, for those, I want to speak to people who are very generous and going out to help and deliver food to those who are suffering with the pandemic. You know, maybe cut down on giving the biscuits and the sweet stuff, but you know, maybe give some more vegetables and eggs and things like that that they can use.
I completely agree with you on that one, Dr. Jamila. I think this has been one of the things that when I work with some local food banks, and you know, they always make a call out for provisions, and the provisions always pour in, and you always get bags of sugar, condensed milk, you get cream crackers, and the all-time favorite, instant noodles. You know, bags and bags and bags of instant noodles. Nutrition-wise, it's not balanced at all, you know, and there is a huge discrepancy about being able to get fresh food to these people. It's bad enough with eggs because they break and make a heck of a mess. But what about vegetables? What about fish? What about meat? You know, these are, you know, very, very challenging things to do and concepts to change. But, you know, we're working on it. So hello to our Facebook viewers, Zuraina Abdul Aziz. She says steaming and boil cooking helps during this pandemic, definitely, especially with the exercise restrictions here. I also like to say hello and welcome to Bob Wong, who's watching. Mr. Wong is my second dad. He's been he's been a very big influence in my life and in the life of my family. Happy Father's Day, Uncle Bob. So there's a general misbelief among certain people with diabetes who say that because their diabetes is controlled, they do not feel that they are under any increased risk of COVID or suffering from COVID. What do you say about this, Dr. Lim?
Karen, when compared to people without diabetes, those with diabetes, regardless of their sugar control, they are more likely to have serious complications. For example, I mean, Prof. Deba would be at a better position to define serious complication there. But in general, what the public should know is they tend to get lung infection, and they will require more oxygen supply. They will require ICU care, and eventually they may die from this serious COVID infection. And what we previously discussed, diabetes is not a single condition. There's always a cluster of conditions. Diabetes plus heart disease, obesity, or kidney disease, and they tend to worsen with COVID infection. So the more health conditions that a person with diabetes has, you're actually at higher chance of getting serious COVID infection and complication, and may even die from it. It's very important to understand that. But of course, when you have poorly controlled diabetes, your risk is even much higher, being inflated. So you need to keep your diabetes under control. Prof.
So if I can jump in there, you know, Karen, when I go and do ward rounds in ICU, the doctors there, the intensivists will kind of introduce the patients as this is Mr. X, a 64-year-old with tiga serangkai. When I first went and what is tiga serangkai? Tiga serangkai is what Liling just said, someone with diabetes, heart disease, and kidney disease, or diabetes, hypertension, and heart disease. It's become, unfortunately, it's become the norm, which is really, really sad. What happens with diabetics is like what I said in the first week, those who contract COVID-19, if they don't have all those risk factors that put them at risk, 80% will recover. But in the 20% who escalate to severe disease and obesity, old age, diabetes are some of the highest reasons for developing this, what we call the cytokine storm syndrome, where the immune system overreacts. I think we've discussed this several times, and that is the complication that we see in patients who end up in ICU for the most part. So it's not a direct virus effect, but the immune system. And in diabetics and in people who are obese, for whatever reason, because they have this chronic inflammation going on, their immune system can't put a brake on the immune system in its effort to try and control the infection. So it kind of overreacts. That leads to the complications that you see. So we watch people with diabetes, people who have a high BMI very, very closely when they're in hospital, and monitor their oxygen saturation, monitor blood tests called CRP. Of course, we monitor their symptoms and all of that, because it's too often that they kind of turn bad and can do so very quickly.
Completely true, what you said, Prof, and very, very scary. Maimuna Yunus, who's watching us right now, thank you for your kind comments. We try very hard to make this as scintillating as possible. Diabetes is not a sexy topic at all, right, Dr. Lim? It's not something that can be jazzed up. It's not something that you can put a very glamorous spokesperson in front of and make it attractive and appealing. But it's something that needs to be said, and it's something that needs to be talked about. May I please encourage everybody who's tuning in right now, who knows, and I bet you know more than one person with diabetes, to come in on the show and to share your thoughts on this, and to also learn a thing or two from a very stellar panel of educationists and medical specialists. So are there different sets of signs that people with diabetes should look out for when they suspect they may have contracted COVID-19, Dr. Lim?
There isn't a different set of symptoms of COVID infection in people with either type 1 or type 2 diabetes. The common symptoms are what we have known so far for COVID: fever, chills, cough, tiredness. Some people may have loss of taste or loss of smell, and there's some warning signs when feeling difficult to breathe. And all this in general will be what I've discussed in the previous series, may appear 2 to 14 days after exposure to the virus. But one thing, that if you have diabetes and you start experiencing the symptoms, what should you do? That's what we tend to face when patients try to ask us about that. First thing, you should continue taking your medications. Please contact your family doctors, or even can contact the nearest clinic or hospital. If you're checking your sugar regularly at home, please do it even more frequently. How frequent? Every 2 to 3 hours. And we have talked about the risk of Dka, a lot of acids in your blood, or even Hss, another spectrum where you may get very high sugar level, you may turn to be very dehydrated. So all this, you just apply the same principles. Try to drink a lot of unsweetened drinks every 15 minutes, stay hydrated, check sugar regularly. If sugar is high, more than 13, check your ketones. Ketones is positive, call the hospital. Okay. Another thing is about blood pressure control. Diabetes and blood pressure, what Prof. Adiba said during her ICU round, is a tiga serangkai thing. So please do not stop or change any of blood pressure medication without discussing with your doctors. If you have any problems, you just call your family doctors and then follow the medical advice. Over to you, Karen.
Should a person with diabetes get COVID? what protocols should they or their caregiver follow? What needs to be done for, say, in-house care of a patient with COVID and diabetes?
I think that I will actually discuss that into two different parts again. First part would be when you are diagnosed to have COVID, first of all, follow the KKM guidance. You stay home from work, stay home from school. If possible, you should be given your own room, keep your door closed. And if you have more family members within the same household, only have one family member who is caring for you. And within the same household, practice additional protection for those who are actually more than 65 years old or with underlying health conditions, because we want to minimize risk exposure to these high-risk people. Then about diabetes per se, more specifically, since you will be able to undergo home quarantine, first of all, self-care remains to be of utmost importance. Apart from sugar check and ketone check that we've discussed, you have to ensure that you have enough supply of medications, whether is it in tablet forms or the insulin injection, for at least 2 weeks or more, because you may not be able to find a way to refill your prescriptions. You need to have extra supplies to maintain your hands sanitization. The other thing is device supplies, your insulin pen or the insulin needle, because you need to inject yourself. There's nobody else that could actually help you. Strips, make sure that you have enough strips for sugar check, ketone strips. If you have type 1 and you're on insulin pump, your insulin pump tubings, it's better for you to have the sufficient supply. The other concept to be delivered to the public is, even whenever that you have infection, it's not only that you actually have a high risk of having very high sugar level. If your appetite turns low because you're unwell, you can't eat much, right? So you're actually at high risk of having hypos, low blood sugar level. In general, we would take it as less than 4 millimole per liter. So you need to keep some simple sugars, such as sweets, or even some a pack of fruit juice or jam, just in case that you develop hypos. You need to correct that, because the end of the spectrum of hypos is you just pengsan and you pass out, you may die on the spot. Okay, and you have to recheck your blood sugar level every 15 minutes and make sure that with the correction of using simple sugars, your sugar level has gone up. The other thing, just all this we're talking about will be physical conditions. Another thing, diabetes patients, even though without COVID, they are also more likely to be stressed, depressed, and being anxious. What more when there's the presence of COVID infection? You try to stay healthy mentally as well. Over to you, Karen.
That makes a lot of sense, yes.
Yeah, I think that's a very nice step-by-step guide by Dr. Lim to advise our public who may be having diabetes on not just the infection control aspect, but also how to care for diabetes, as if we haven't got a bad enough problem with diabetes. With what was it, Lily? 1 in 5 person having diabetes in this country. We also know from recent research that it's looking as if COVID itself, infection with SARS-CoV-2 and having COVID-19 itself may lead to one of the complications is diabetes, because it affects, the islet cells of the pancreas and so forth. So, getting vaccinated and avoiding all the things that we've been talking in the last 18 months to not get infected in the first place is also very important, so that we don't add to that statistics of 1 in 5 Malaysian having diabetes to 1 in 4, 1 in 3, because Liling will pingsan, having to look after all these patients with diabetes.
Yes, thank you, Prof. Adipa, for highlighting the issue. Yeah, Karen, over to you.
So, Dr. Lim, if a person with diabetes needs to be hospitalized for COVID, what should they need to bring to the hospital?
First of all, it's always been very useful for patients to tell us who are your attending doctors and clinics. Okay. The other thing that would help us a lot would be please bring all of your medications to the hospital, or at the least try to write down the names and dosages of medications. What would be the milligram, and how many tablets, and how frequent that you are taking, and when was the last dose of medications. If you are actively checking on doing self-care at home, bring along your sugar diary, your blood pressure diary, and your ketone diaries. Why? You say, oh, I can just verbally tell you, no, because we want to gauge how good was your control in the previous days. I mean, even I myself, I cannot remember what I've eaten yesterday. And then what do you expect from patients where they're under serious stress, they have diabetes, and then they have COVID infection? Then if possible, you can also bring your own home use sugar meter. And if you were to be hospitalized, it can be used to self-test your sugar levels in the hospital. Another thing is please share your contact history and travel history with the hospital team. This will make our job even much easier. Prof. Adiba's team, much easier.
All right. So can we talk a little about the effects of long COVID and people with diabetes, Dr. Lim and Professor Adiba as well? I think you have insight on this, please.
Maybe I shall start first.
Maybe I can kick off. I think the whole long COVID phenomena is something that's being keenly observed, and you might hear the azan in the background, so I don't know if you can hear me. So it's still, we still don't know a lot about long COVID and who is at risk. It would appear that even people who don't have symptoms of severe disease can develop long COVID. So the quick answer is we don't know if people with diabetes are at much. I don't know, at least I'm not aware of any recent research in it, but it is something to be keeping an eye about. We both us and KKM hospitals are starting to monitor our patients for long COVID long term, so we might know in the next few months to a year.
As a follow-up to Prof. Adiba's comments just now, she actually raised an issue saying that COVID infection may lead to new onset diabetes, and this may even hamper our efforts of curbing diabetes pandemic in Malaysia. This is actually, that is signal. This could be a potential complication for COVID survivors, which we need, as endocrinologists, we need to watch out for. It seems that when trying to look into results from the States and the UK, they have seen an increase in new onset diabetes up to 5 months of follow-up of patients who have survived from the acute COVID infection. And there's been some international effort trying to look into, their step up a registry, trying to look into whether the diabetes state post-COVID is permanent and what would be the potential mechanisms. We still do not know the answer. A lot of hypotheses, whether is it because due to cytokine storms or diabetes or patients, there's an increased release of a lot of hormones that raise the blood sugar level. And one thing that Prof. Adiba has mentioned just now would be the coronavirus may directly infect the beta cells in the pancreas, which produce insulin, and therefore you have less beta cells. Your body cannot produce insulin to tackle the high blood sugar level, and therefore you're actually at higher risk of having a true diabetes later on. Still an early stage. Hopefully we'll have more information later. Over to you, Karen.
Yeah, one more risk factor for developing diabetes is what we do for patients with severe COVID is the treatment itself with corticosteroids that we use in patients with severe COVID-19. So dexamethasone can induce diabetes. So that's why COVID-19 is a challenge for us all. It's not just for infectious diseases to manage them, but all hands on deck, because it can get very complicated.
All right, so we've got quite an interesting chat happening on our Facebook Live. There's a question about a person who is living with their 80-year-old mother in the same house. with the mother already having completed her second dose of vaccine. And this person is asking for any advice. Generally, ma'am, I'm not sure what you're actually asking. You're not saying whether your mother is diabetic or not. If you're asking if it's all right in this time of pandemic for an 80-year-old, an elderly, and a high-risk person to be in a house with younger people who might be bringing in their different germs into the house, I will perhaps let Dr. Jamila answer that.
Yeah, I think first of all, well done. I'm so happy to hear that your 80-year-old mom has been fully vaccinated, which means that, you know, she is protected much more than if she wasn't. I think the general public health measures that we mentioned consistently will apply, which means that, you know, keep your hand hygiene, your nasal hygiene, make sure the house is well ventilated. If anyone is feeling unwell, don't go near grandma or mom, you know, because there is still some cases that have what we call breakthrough infection. But, you know, the chances are she is better protected than all of you who are not vaccinated. So I hope you also all get your vaccination soon. You know, these are very trying times. We're going through another cycle of COVID, cases rising. So I think, you know, minimal outdoor exposure, you know, but really get fresh air into the house. I think this is really important, and get your mom to take little walks outside the house if possible, eat well, you know, just take care of her general health and the usual public health measures that we consistently remind everyone. I don't know whether Adiba, you want to add anything more to that?
All right. So, well, since we're on the subject of vaccinations, as we normally are towards the tail end of any show, let's move on to how vaccination protects people with diabetes against COVID-19. Dr. Jem, are vaccinations safe for people with diabetes?
Yes, so absolutely. In fact, they should be prioritized. And this is exactly what the government is doing to make sure that those with comorbidities are vaccinated along with those who are elderly. So yes, please, you know, there's a lot of misconceptions out there. Like, if I have a comorbidity, I should not be vaccinated. You know, if anyone tells you that is not true, and you need to get vaccinated as soon as possible.
So is there a better brand of vaccine for diabetes patients, Dr. Jim, or are all equally non-complicating for people with diabetes?
Adiba and I will do this in unison. 1, 2, 3, Adiba. The best vaccine.
The best vaccine is the one that's in your arm.
First. I mean, we've been saying this over and over again. We should make a song out of it, right? The best vaccine. The best vaccine is the first vaccine you get into your arm.
All right. So so I think I need to also reiterate, a lot of the times, because of the way people interpret messages, where they say people with comorbidities have to be careful when they're getting vaccinated. They take it as in, oh, it's dangerous for people with comorbidities to be vaccinated. But the truth is, the people who are administering the vaccines just want to know that you have prior complications, right, Dr. Jim? And why is this important?
Yeah, I think generally, you know, just as you go to a doctor when you take a history from the patient, you ask these basic questions, you know, do you have any illnesses? What medication are you on? And so on and so forth. We have seen some, very few, but not a lot, cases where, you know, it's anxiety, and if they're hypertensive, sometimes the blood pressure goes up a little bit during that time. And they may have a bit of a headache or whatever, you know. So I think people just want to know, but it is not a contraindication. If you're diabetic, you're hypertensive, you have heart disease, not a contraindication to vaccination.
So go off and make that vaccination appointment. If you haven't already, please use your My Sejahtera app. It's very, very easy. Put yourself in the running. They will contact you. They know you are a person at risk. They will take all the efforts possible to make sure that you are seen to as soon as possible. So we have a question about quality of life of patients with diabetes during this pandemic and how to enhance it. Li Ling, would you like to take this one, please, Dr. Lim?
Okay, Thanks for the audience for raising this question. First of all, I mean, irrespective whether you have diabetes or no diabetes, your quality of life will have been affected by the COVID pandemic. And if you have diabetes, together with living in the current era of COVID-19 pandemic, we would expect you may experience the worst quality of life. How to tackle that? Psycho-behavioral support by your healthcare team. So it's a very good suggestion. I mean, quite a number of studies which have been conducted during this period that have shown that diabetes patients, they do complain of a worsening of their quality of life, or even depressive symptoms or anxiety symptoms. So maybe it's time, Prof. Adiba, that maybe we should think about some strategies from UM or together with Tan Sri Jamila. We may need to look into this matter in Malaysia of how to help and support patients with diabetes during this COVID pandemic. Telemedicine is one way, but in general, we're actually quite restricted because we tend to tackle the more burning conditions during the virtual clinic consults. It would be a good suggestion. We will take that into consideration. Thanks.
Yeah, maybe the National Diabetes Society and other NGOs can also play a very big role in this. Yeah, good suggestion.
I think also when we talk about telemedicine, doctors, there is always the challenge of Malaysia being so multilingual that it is very difficult to have one specific hotline targeted to very many different speakers, you know. So if it's manned only by people who speak Malay, then that completely negates the person who speaks only Mandarin, who speaks only Tamil, you know. So that is one of the issues at hand when it comes to targeted, focused telemedicine campaigning. But I think community engagement is very, very important. Being part of a community where there is enough advocacy, there is enough education, and there are enough people who speak in the voice of scientists and for science, you know, to be in a community where people don't just forward, these are quick cures for diabetes, you know, do this and you will never suffer from high blood sugar again. You know, it's very difficult. So Dr. Lim, before we wrap up the session, can you talk a little bit about pandemic eating, eating beyond one's caloric needs, and whether this will actually lead to a spike of people with diabetes, and what does it do to a regular person endocrinologically? You know, we might not be diabetic, but we're loading ourselves with all this stuff, you know. So what happens to our body then?
I think, Karen, we need to be vigilant. First of all, we need, even though in general population, you do not have diabetes, you need to understand saying that if you are carbohydrate loading your own body with all this unhealthy diet or food, then eventually this will definitely increase your risk of getting diabetes a few years later. Okay? We need to try our best to practice healthy lifestyle. Suku Suparo, that's what Prof. Adiba has raised just now. Try to exercise more. I mean, we have a lot more free YouTube videos being uploaded nowadays, right? You have virtual studios if you have gym memberships. So, I mean, a few of my patients actually, when they came back for regular clinic follow-ups, they have lost weight. Not because their diabetes is poorly controlled, but because they do have time to spare and the self-awareness is high. They try to change their behavior and they follow free YouTube exercise videos. And the diabetes just amazingly, without any intervention from myself, has improved remarkably, and then I label them as a good role model to other patients. Okay, this is very important, self-awareness, then of course with support from the family members as well. Over to you, Karen.
Just inspired me, Dr. Lim. I'm going to look for one of these virtual gyms now.
Yes, Yes, I mean, she even, I mean, the patient even tried very hard to influence other patients waiting in the clinic area, saying that, hey, just follow 3 YouTube videos, and then each YouTube video half an hour, 1 hour, and then that's me. Okay.
All right, so once again, we've come to the end of another Sense with Science session. Thank you so much, endocrinologist and Associate Professor Dr. Lee Ling Lim, for your expert advice and input. You've been such a great asset to the show, and you've been so kind in the way that you've put your points across. It's been very, very comforting, but it's also been eye-opening to speak to you. Is there anything else you would like to wrap up with, something that you want to tell our listeners and our viewers, please?
Thank you, Karen. It has been very engaging discussion. For people living with diabetes, you are not alone. Yeah, any problem, just call your family doctors, clinics, or hospital. If you do face anything, we're always been around to help you. Remember, try to practice as much self-care as possible during this hard time, because poor control of diabetes would actually increase the risk of getting serious COVID complications. Stay home, get vaccinated if you haven't already.
All right. Thank you so much for that, Dr. Lim. Dr. Jamila, just a very quick update on what you're doing with your vaccination, your mass vaccination centers. Before we wrap up, can we just have something that you're working on for this week so that people will know?
Yeah, first of all, let me tell you some exciting news. Thanks to our Sense with Science episode on pregnancy, we have managed to increase the number of registrations of pregnant women to almost 100,000 now. And because pregnant women have a fairly narrow window to be vaccinated with their first dose, the Ministry of Health is reviewing some of the guidelines, which is great. But very excitingly, next weekend, we will have a dedicated weekend for pregnant women and trying to do 3,000 women at MyTech in Kuala Lumpur. Wow. And other centers as well, most likely in Sunway and others. So we need to start moving the Pfizer vaccines to some places to give this one. So I'm very, very excited about this, and really thank you again to our listeners for also being great champions and getting their friends to register, and all of you who reached out to me in crazy ways, but I've managed to keep in touch with almost everyone who wrote to me. Please don't make it a habit, because I can't cope anymore. But the good news is that it's going to happen, right? Mass vaccinations for pregnant women as well. So this morning we have set up, and rather we are launching tomorrow morning at Bukit Jalil, a mass vaccination center. And as you know, KL and Selangor are having very high number of cases. So this is really the epicenter. We need to control KL and Selangor, Klang Valley and Selangor. So that vaccination center, the mega vaccination center, will ramp up gradually, and we hope to get 10,000 people coming per day, but we'll start with slowly. And that center is going to be dedicated to those who are 45 and below. So that, as you can imagine, it's a stadium, so there's quite a bit of walking as well. So there's good exercise for all of us. I'm currently speaking to you from Cameron Highlands, where I've just arrived. There's an outbreak here, and we're going to see how we're going to look at the farming community, because they are ensuring our food security. So if there are outbreaks in the farms, we've got to make sure that what is the demography of the farming community that we need to vaccinate as well. And then how do we vaccinate orang asli and so forth in this area. So it's we are all trying to ramp up. The good news is our supplies start increasing quite a lot from next month. So July, August, we start getting more and more. I think we are expecting close to 10 million doses July. So by the end of July rather. And then also the very good news that CanSino has been approved, and that's a single dose vaccine. So that will come probably in August. And with the single dose vaccine, for some people, it will be more suitable. Those who are in the interior, homeless people, refugees and so forth. So I think you know, we just have to keep going. You know, we are not in the same privileged position as the West that has 75% of the vaccine load right now. We are trying to get as much as we can, and I think Malaysia has done quite well. But we just have to keep going. Thankfully, many Malaysians have registered, but still not 80%. And we have now the vaccine that is approved for 12 to 17. So we can also start vaccinating teenagers and adolescents. And I think that will help us, particularly we're going to focus on exam years, right? The Form 5, Form 6, and the teachers, of course, so that, you know, the children can start going back to school.
That makes fantastic sense.
Yeah,
I love listening to that.
But I think what Adiba and I have been saying consistently, vaccine is one tool we have in our toolkit. We must continue with our public health measures, you know, social distancing, the whole, you know, we talk a lot about ventilation, about hygiene, but I think more and more now we have to start pushing for things like home testing, that might be freely available, that, you know, we can monitor ourselves as well, right? We know, for example, that if you are vaccinated, the chances of you getting severe disease is extremely low. So the important thing is, if you are, you know, if you're COVID positive, let's not stigmatize COVID, you know, so that we can detect the people early, we can isolate them early, and then, you know, I mentioned earlier on the previous show about how it's important to have if you can, a pulse oximeter at home. Since that show, I've known so many people now who have been positive, and who, thankfully, when they contact me, I ask them, do you have a pulse oximeter? They say, yes, we have invested in one. So I feel really relieved. But, you know, we all have to look for, you know, as you mentioned about, you know, how do we use technology, digital tools, but we can't forget that we must continue testing.
Absolutely. Just a small note to our viewers. Centered Science is a passion project. We don't have anybody, any government agency. We are not aligned to any specific ministry. It is truly the work of Dr. Jamila and Professor Adiba. I asked on behalf of the people who run our Facebook, thank you, Amanda, that you be polite and that you be kind in your interactions on the Facebook. There is a real human being at the back of every single interaction that is made on our page. And these human beings feel it when you are being rude, when you're being demanding, when you are assuming that you have a right to be given an expedited vaccination date just because you've made enough of a noise on our page. As a person who works in mass media, as a person who works in new media, I will tell you that this is not something that we stand for. We believe in the integrity and the dedication of our team, but we also believe that professional courtesy and a sense of humanity is very important to what we do. So please, no trolling, and keep everything positive on the site. Professor Adiba, I just need to check with you whether on the ground you're doing okay. You and your staff, you and your team are seeing patients every single day, opening up more and more beds, more than you can cope with sometimes. How are you guys doing on the ground?
Karen, to be honest, yes, everybody's exhausted, not just my team and I at PPUM, but I think all healthcare workers, doctors, nurses, PPKs, everybody. So we need every Malaysian to play their part. I think all of us want to move on, not least because of the enormous economic and societal impact this pandemic has had. But just to close off, I'm going to wear a general physician's hat and actually advocate for diabetes. I'm going to take the place of Dr. Lim, because I've been, you know, I've joked with my colleagues that if I have another chance, I think I'll go and I'll become an endocrinologist, specifically as a diabetic physician, because I just worry so much when I see, the numbers of people with diabetes escalating. And what concerns me is the laissez-faire attitude that Malaysians take towards diabetes, and end up having, early kidney failure, early, diabetes, eye complications, early heart attacks, early early everything because the diabetes has ravaged their blood vessels. This health transformation work that Tan Sri Jamila is leading, I think one of the things it pointed out to was Malaysians are living longer, but not necessarily better. So because modern science, people like Dr. Lim is able to take care of you even if you have diabetes, but develop all these complications, but you're not actually having that good quality of life that you can possibly have without the disease. So please, next time you're reaching out for that teh tarik and nasi lemak, think again.
Absolutely. You can have it. If you're going to have a drink, just make it kosong, it doesn't mean that you have no pleasure in life. You just have to,
everything in moderation.
Yes, everything in moderation. Don't you agree, Professor Lim?
Yes, I mean, Prof. Liba, thanks for raising the issue of the importance of prevention of diabetes, prevention of complications among people with diabetes. This will actually save your life, save the healthcare costs, save our economy. Yeah, prevention is very important. We don't want you should remain as healthy as possible without any health conditions.
Absolutely. This is for the best, and this is the best thing that we can do for ourselves, for our families, and for our nations. So this has been Sense with Science, made possible by Pusat Perubatan Naluri and Astro Awani. I hope our conversation today will help people with diabetes take a more in-depth look at their lifestyles and seek out better medical assistance from their healthcare professionals. I'm Karen Michaela Tan. Thank you for joining us today. Remember to stay kind, Malaysia, and stay home. Have a good week ahead, everyone. God bless you all. Bye-bye.
Bye.
Bye-bye.